Welcome to the ATS Breathe Easy, the latest podcast. Here's your host, Patti Tripathi.
Hello and welcome. I'm Patti Tripathi, and today we'll talk about why clinicians need to work with public health officials during outbreaks. But first, here are the stories in the headlines. The measles outbreak is wreaking havoc. The number of cases is rising. And with reported infections on the East Coast, including New York and Pennsylvania. Meanwhile, the Department of Health and Human Services is in a spiral. The good news, vaccines are on the way to Texas. Federal cuts are taking a toll on workers across the U.S. There have been large layoffs at many of the federal agencies, including the Centers for Disease Control and Prevention. And as the U.S. experiences preventable outbreaks of tuberculosis and measles, the administration is also canceling contracts, providing medications to several low-income countries. Clinicians and researchers have expressed concerns that science is not guiding these actions. Join the Stand Up for Science 2025 rally on Friday, March 7th. The rally is being organized in New York City, Washington, D.C., and other cities nationwide. For details, go to standupforscience2025.org. It's a pleasure to welcome past president of the American Thoracic Society and lung cancer expert, Dr. Patricia Rivera, to the show. Dr. Rivera, many physicians will not have seen measles in their practice. What are the symptoms they should be looking for?
Thank you, Patty. I just want to say I'm the immediate past president, so still on the executive committee of the ATS. But yes, many physicians likely have not seen measles in their practice. The earliest symptoms are cough, runny nose, and conjunctivitis, or very red, watery eyes. Usually that is followed by sores or spots that can be seen inside the mouth, and very high fever. A rash usually develops a few days later, and it's a rash that typically begins in the scalp and the head, and then sort of descends down into the trunk and the extremities. People who are exposed and have no symptoms may not know that they have been exposed. The incubation period can be 7 to 14 days. So people can be infectious before the rash develops and several days after the rash develops.
Dr. Rivera, my father told me last night that he had measles when he was young in India, and mostly it was scars and rash on his torso area, and he had high fever, but no other symptoms he was recalling back when he was a teenager. And is that a possibility? You don't have conjunctivitis and other symptoms, just have rash in certain part of the body?
So the rash is pretty distinct. So it's pretty common to have fever. The conjunctivitis, the very red, watery eyes, is pretty common with measles. And the rash is typically a rash that, again, starts at the scalp and the face and descends down. So the measles rash would be unusual if it starts, let's say, in your legs and goes up. That is typically not seen with measles. Now, do all people get cough? Do all 100% get conjunctivitis? I don't know enough about measles to answer that with accuracy, but those are the most common symptoms.
Okay. If a patient shows up at the hospital or clinic with measles symptoms, or if the individual is suspected of having measles, what should health personnel do?
So immediately we isolate individuals who we suspect have measles or any other very contagious respiratory viral infection. You test for measles. If positive, you contact the health department, because it's important for the health department to have this information, as they are able to then do trace contacts, get a good history of where the patient has traveled recently, or where they work, or where they go to school, so that individuals who may have come in contact with the patient are notified. We usually adhere to standard airborne precautions, including not only for the patient, but for us as healthcare professionals to ensure that we're wearing appropriate respiratory masks. And we have to make sure that the healthcare personnel who are going to care for these patients have appropriate immunity. So if they know they've been vaccinated or they have proof of vaccination, that's critically important. And if they haven't been vaccinated, then obviously they should receive the vaccine.
And who is the highest risk of contracting measles? You were saying that it could be fatal to an unborn child, a woman.
So it's really unvaccinated individuals are at the highest risk because the measles vaccine is highly effective. Children under the age of 5, pregnant women are at risk. So we have to be extremely careful among pregnant women. And people whose immune system is compromised, so people who are getting treated for cancer or who are on medications for other diseases other than cancer that suppress their immune system.
And what is immune amnesia? And how does it affect individuals who have contracted measles?
So immune amnesia is when your immune system forgets previously acquired immunity, including prior vaccines to prevent other infections. And measles is known for its significant ability to wipe out portions of the immune system's memory. So it's concerning because if your immune system forgets about immunity to other infections, you're then susceptible to getting other infections, secondary infections, including bacterial infections.
The ATS 2025 International Conference returns to San Francisco May 16th to the 21st. Members get a discount on conference registration, so become an ATS member or renew your membership to take advantage of these savings. At ATS 2025, you can network with colleagues, find your next research collaborator, listen to patient stories and get inspired, and be among the first to learn about breaking news in pulmonary medicine. Register now to attend. Go to conference.thoracic.org today.
What is the role of public health workers in a disease outbreak?
Well, critical, very critical. Public health professionals trace diseases, how it's spread. They identify contacts that individuals with an identified communicable disease has been exposed, has been in contact with. They help develop very important vaccination campaigns to get the word out and help to implement programs so that we can increase the public's awareness of the disease and how to prevent it and how to get vaccinated if you haven't been vaccinated. So it's a critically important job to help us disseminate the information.
And how do you feel about the latest decision, which came just yesterday, to direct federal agencies, including the Centers for Disease Control and Prevention, to provide support to Texas health authorities?
I think it's wonderful. I'm very relieved and happy. Federal health agencies provide critical technical support, laboratory support. They provide the vaccines that are necessary in counties or regions and states, as well as any medication that may be needed, again, especially vaccines. So it's the way it's supposed to work, and it's wonderful that that decision has been made.
How does research funding benefit patients?
Oh boy, where do I start? So well-funded clinical research that includes all people at risk for disease that is being studied leads to more comprehensive results that yield robust and reliable findings that then help all people who are at risk for that disease. So when you have, good funding, you can then extend and be able to recruit individuals from the entire population who are at risk for the disease that you're studying. There was actually a really good study, and I can't remember what year it was, from Ohio State University, that found that federal research funding had what's known as a ripple effect because it stimulated new studies beyond what the initial grant was studying. So individuals who are part of a grant then break out and have new ideas related to the topic, but different. So more and more research is developed because of that original funding. So I had never really thought about that ripple effect and how important it is, but that was actually a lovely study. Research funding is what really helps us to identify, understand, diagnose, and treat conditions, particularly rare conditions. And it's also important in terms of preventing and managing diseases. So I think what most of us forget is that, research funding improves the services and the treatments that we receive as individuals, but it's also critically important for future generations, our children and our grandchildren. So I think it is not just a one-time thing, it's a continuum.
And the ATS, of course, and its members understand the role of scientific inquiry. Why is it important to trust science?
Oh, well, science seeks to build reliable knowledge and to provide scientific explanations, and people can use that knowledge and that scientific explanation, particularly in medicine, to better understand disease processes, to better prevent diseases, to improve treatment and thereby outcomes in diseases. And also, when you have scientific explanations and you have reliable knowledge, I think it's very important in terms of making informed decisions with patients, because a lot of what we do requires that we make the decisions together, healthcare professionals with our patients, with our communities. And I think when you have reliable information, then you can make better decisions. For me, I've been a healthcare professional for over 2 decades, and I believe that science and research is conducted by experts in the field in their specific areas. I have seen the evolution of scientific experts engage communities to understand what is needed at the community and what should be the priorities in research for that particular region or catchment area or community. And the results are shared with the public. So I think that for me, that's why I trust science, because I think, again, it's being done by people who have expertise, who are responsible and engaged and committed to their communities and provide us the results of what their studies found.
Thank you, Dr. Rivera, for all the knowledge that you have imparted today, and hope to see you soon.
Thank you so much. Have a lovely day.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.